I would share some insight into the operating room for all of my pre-meds out there and give you some tips on what it's like and my experience. So your first time going into the operating room, if you are nervous, trust me, that feeling will subside. The more time you spend in the operating room and the more time that you get to interact with the others, the more confident, calm, cool, and collected you will be. Going into it, I thought that I was going to be terrified about knowing where to stand, what do I do with my hands. You kind of have to feel the room, feel the vibe, and understand what's appropriate and what's not. You have to figure out for yourself where's the best place for me to be. And very rarely will anybody really tell you where to stand, in my experience. Don't touch anything blue, don't touch anything green, that's all sterile. So what I like to do is I figure out where is the best angle in the room, and then I will find that spot and get as far away as I can while it's still close enough and visible and appropriate, where I'm not in anybody's way. And you'll have nurses, you'll have medical students who are really nice and tell you, hey, this is a really good spot if you want to stand right here, and we'll walk you over and show you. I would suggest not being on your phone. I try also to not, I ask questions when it's the right time, and I am quiet when it's appropriate. When I go into the operating room, the first thing I do is check the board to see what kind of operation are we doing, how old is the patient, just stuff like that, so that I'm aware of the situation when I'm walking in. And sometimes they may invite you over to take a look at the scans before they begin operating, or any of the imaging, which is nice because it also helps to give context. And then after the operation, when I'm walking down the hall with the surgeon, that's when I'll ask my questions. And the more I get comfortable with the surgeon, the more it's more of a conversation and not like a Q&A. You know, I try not to make it an interrogation. I try to keep it, appropriate. You don't want to bombard them. They have a really difficult job. So I try to be respectful and appropriate when I am communicating with surgeons. And be prepared for people to talk to you. Again, the more comfortable they get with your presence, the more they want to talk to you and learn about you, asking you questions about yourself and then telling you about their job or what they do or giving you more insight. So be prepared for those kinds of conversations. But yeah, you'll get to do really cool little side quests too when you're observing. And every physician's different. Some feel more comfortable with some things than others. Be prepared to really be on your toes. Everything's not going to be fed to you. It really depends on the hospital, the physician. It's really an honor, and it's a blessing to get to go around and observe. But you'll do great. It's an amazing experience, and you'll love it.